Today, today we're talking about trigeminal neuralgia, aka tic douloureux. This is a common topic, like on the pants, and I've seen this asked multiple times during my time in PA school. So let's go through the pathophysiology first. So it's trigeminal neuralgia is a dysfunction of the trigeminal nerve, which is cranial nerve 5, and this nerve provides sensory innervation to the face. So trigeminal neuralgia is most commonly caused by vascular compression of the trigeminal nerve by the superior cerebellar artery or tortuous vein in 90% of cases. This compression causes like focal demyelination of the nerve and results in abnormal nerve firing. So basically what you have to understand is that there's an artery compressing the nerve, and this causes this abnormal nerve firing, which leads to this lancinating sharp shooting pain these patients get in trigeminal neuralgia. So it most commonly occurs in the maxillary and mandibular branches of the trigeminal nerve, which makes sense because usually these patients have this pain that's lancinating on the side of their face. It's usually on one side. And in younger patients, it's most common in middle-aged women. If you see this in a younger patient, less than 40 years old, or they have like bilateral trigeminal neuralgia, consider multiple sclerosis as a cause, because multiple sclerosis, you have these demyelinating plaques that can affect the trigeminal nerve and lead to these abnormal nerve firing, and they'll get these trigeminal nerve symptoms much earlier in life, or they'll get it bilaterally. So other possible causes are anything that's compressing the nerve, causing excitability of the nerve, such as like tumors or any other structures compressing the nerve. Clinical manifestations. So your hallmark symptoms that you're going to see in a vignette. You're going to have a patient presenting with sudden, severe unilateral facial pain. Usually after they took a walk outside on a brisk cold day and cold air was hitting their face. They'll report like an electric shock like episode of episodic pain that starts near the mouth and shoots towards the ears and the eyes on the same side. And these episodes last seconds to 2 minutes. And light touch to trigger zones induce episodes of trigeminal neuralgia. So the trigger zone would be like on the side of the face where the maxillary and mandibular branch of the trigeminal nerve is. So inciting things that could cause an episode are things like talking, chewing, brushing teeth, cold wind, like we were speaking about in the vignette earlier, and shaving. Anywhere that you touch this nerve along its nerve path, and the patient will have pain-free intervals. Trigeminal neuralgia is an episodic disease. So at physical exam, your neurologic exam is most commonly normal in patients with trigeminal neuralgia. They're not going to have any like apparent like neurological deficits. The patients may experience like episodes of trigeminal neuralgia due to the light touch to these like trigger zones on exam. But if you do have any neurological deficits on exam, such as like decreased motor functions, this warrants like a further workup for like a secondary cause of trigeminal neuralgia, like a possible mass or multiple sclerosis or something like that. And diagnosis. So this is commonly a clinical diagnosis. It, in a setting where there's the absence of any alarming history or any physical exam findings suggestive of a secondary cause. When it comes to diagnostic testing, an MRI of the brain is the gold standard. This will allow you to see any like neurovascular compression from like the superior cerebellar artery or any tortuous veins or any of that. It'll allow you to see any secondary causes like multiple sclerosis, like the plaques from the demyelination of the neurons, and you'll see any tumors or any other structural abnormalities. But most of the time, it's commonly a clinical diagnosis. So medical management. This is very important and very high yield. They love to ask this question on exam for trigeminal neuralgia or also tic douloureux. You can't forget its second name. Carbamazepine. This is the first line medication to treat trigeminal neuralgia. So carbamazepine reduces the repetitive nerve firing, stabilizes the neuronal membranes, and has a use-dependent blockade. That's a little too deep into the woods, but basically all it means is that it targets neurons that are constantly firing. And since this area, this trigeminal nerve and trigeminal neuralgia, is constantly compressed, or it's demyelinated due to multiple sclerosis, or it's compressed by a tumor or any artery, it's very excitable nerve tissue. So the carbamazepine selects for highly excitable areas compared to areas that are not as excitable. So it's very specific to the site of the hyperexcitability and blocks the nerve firing. So with carbamazepine, you do have to monitor CBCs and LFTs because it does come with a risk of agranulocytosis and hepatotoxicity. And oxcarbazepine is an alternative second line drug. It's an active metabolite of carbamazepine, and it's useful in patients who can't tolerate side effects from carbamazepine. You could use oxcarbazepine. Other medications include baclofen, lamotrigine, gabapentin, pregabalin, phenytoin. As you can see, there's a lot of like anticonvulsant agents and agents that decrease nerve firing to decrease the excitability of the trigeminal nerve, which will decrease the pain. So medical management's not curative. It helps decrease the episodes and decrease symptoms, and other general management is like avoid known triggers, soft diet during episodes, and regular follow up. And there's also surgical management. So the surgical management, this is out of our scope, not out of our scope as PAs, but you're not tested on this as much in PA school. There's microvascular decompression. This is a definitive treatment for patients who have the superior cerebellar artery compression. And there's stereotactic radiosurgery, which is the gamma knife radiation. And then you have like other percutaneous procedures. But pretty much that's like a quick rundown of trigeminal neuralgia, and that's all you need to know. And we'll have more topics coming soon.